Welcome, everyone. Healthcare plan update as this is presented.
Yes, sir. Good afternoon. Lynette Hall Lewis, Deputy of Human Resources. And Ryan's going to help me out.
We all need that.
Okay,
Let the record show Mr. Pearson sitting in the back of the room lurking. Welcome.
got it? Thank you. All right. Well, we'll just jump right into the agenda. And so we will start with the healthcare plan update. And so the biggest update that we have for you right now is that we already have our open enrollment dates. They're on the screen. It will begin for our active and part-time employees. It will be a passive enrollment, and it will begin on October 7th through the 25th.
Can you describe passive enrollment?
Passive means that if no action is taken by the employee, they will re-up the benefits that they have.
Excellent.
Yes, sir. And then we will begin the retiree enrollment on November 4th through the 22nd.
And that is not passive.
It's passive as well.
Okay.
Yes, sir.
All right.
Just making sure. Okay, and so next we will have our financial update from our comptroller, Ms. Demetrius Wyatt. Please come to the podium.
And the mics are on there. You can just hit a button and pull it close to you so people can hear you. This is allowing people at home to hear us too.
I need to turn the air on.
Welcome. Just give us your name and address for the record and get that close to you. Green light on? Okay.
Yes.
Now it
Now
is.
it is.
Okay, good.
Sorry about that.
Sorry.
Demetrius Wyatt, Interim Comptroller for the City of Memphis. I am here to present the healthcare and OPEB financials for the period ending March 31st, 2024.
Are you using this document?
Yes, sir. Yes.
So this is the document we're in? Okay. Go ahead.
Yes.
Would someone
The-
drive for her on the computer? How's your interim going so far?
So far, so good.
I'm glad you're here.
Thank you.
So is Mr.
Keeping up
Person.
with
He's lurking in the
busy
back, making
schedule,
sure you're
meetings
looking.
and, no. No.
That's right.
If he wants to lurk closer, that's
Yeah,
fine.
yeah.
You know.
Well, what can we say?
There's a few, there's room at the table. No.
I think most of us have this. I just have this on in case it's being recorded. People can look at it, but may take IT just a second to get this up.
Okay. It's my first time, or
Yeah,
so
it's
if I
it's
go-
okay. It's
go too fast or too slow or anything, or just let me know. But I'll just
okay. Well, yeah, I know. I'm just doing a new electronic medical record in the office, and they've done studies on that with doctors. So when you do a new electronic medical record, for the first 6 months, you see 50% fewer people. And then after 6 months, you go back to 70% of whatever it was you were doing before. And each time you change a record, it does the same thing to your volume, which is why you can't get an appointment with a primary care doctor, because they used to be able to see 40 or 50 people a day, and now they can see 15 because they've all had 2 or 3 electronic medical record changes. I don't know what that has to do with comptroller presentations other than it is electronic.
One of the more interesting things on Word.
Good. Well, I'm glad to be able to pass on some interesting things. Yeah, sorry guys, so scary. Looking close. Are you still trying to find it? Got it.
Dr. Warren, do you see a big uptick in Memphis crowd or whatever it is when the weather changes?
You always do. Although in the past week I've started to see COVID, and I hadn't seen it for a month or so. So I'm wondering if we're starting to get that latest variant coming through. And one thing most people I don't think realized was about 6 weeks ago, CDC recommended that people over 65 and with chronic health conditions get a booster of that shot that everyone got last fall. And what's okay, I think we're ready. Almost. I think I saw the front page. That's the one we want. And page 2, and I think you're up.
All right.
Okay.
Yes, we'll.
Keep going down. That's the one we want right there. There we go. Right.
All right.
Go ahead,
This is our,
Madam Comptroller.
as it says, health insurance and OPEB funds comparison analysis for the first 9 months of this fiscal year, FY '24, in comparison to the prior fiscal year as of March 31st, 2023. You will note that year-to-date, as of March 31st, 2024, we have total contributions of $61.4 million, 51.8 of which are employer premiums versus employee premiums of $9.6 million. Other revenues, 6.2 million, coming to a total revenues year-to-date as of March 31st of 67.6 million. And again, this, if I didn't say it earlier, this is for the health insurance fund. We'll move to OPEB shortly. Expenses for the health insurance fund are 62.1 million. As you can see, as usual, most of it is in regards to health claims expense, which was 51.2 million as of March 31st. Coming to a change in net position, revenues less expenses of 5.6 million. When we add that to the net position at the beginning of this fiscal year, it was 25.6 million. So total net position for the health insurance fund as of March 31st is 31.2 million. In whole dollars, 31,175,559.97.
That's what we have in the bank.
Yes.
Okay.
For this fund, yes, for the health insurance fund, for the actives. And as you can see, when you compare that to the same time period last year, March 31st, 2023, we were at a total net position of 19.2 million, which means that the fund has increased in its value by almost $12 million, by $11,975,000. And when you look at the revenues, you'll see that there is also a year-over-year increase by 2.2 million. Total contributions, 1.3. Other revenues accounts for the other 0.9 million. Expenses, year over year, are about the same at about 62 million. Now let's look at the OPEB Trust Fund actuals as of March 31st, 2024. Total revenues equals $18.1 million, with total contributions at 16.8. Employer premiums account for almost $14 million of that amount, with employee premiums at 2.9 million. Factoring in other revenues, again, total revenues is $18,132,576.87. Expenses for the 9 months ended March 31st for the OPEB Trust Fund totaled $18,729,439.31, leaving a negative net position for the fund year-to-date of $596,862.44. When you factor in unrealized gain, which is income on the investments for the OPEB Trust Fund, $327,000, and add that to our beginning of year net position of almost $11 million, we have a total net position for the OPEB Trust Fund of $10,723,484.76. Again, it is lower than the beginning of year net position because FY24 income for the fund is negative. When we compare that to the March 2023 financials, you will see that revenues year over year are higher by 2.2 million. The expenses are also higher, just not to that degree. They are higher by $544,658. But again, both funds have a positive net position. Health insurance, 31.2 million, OPEB, 10.7 million. The next two slides.
Next slide, please.
Next slide.
You hit that button? Okay. All right, keep going.
Okay. The next two slides just show gives you a visual of both funds. The next page is regarding the health insurance fund. It shows, as probably no surprise, employer premiums accounts for over 3/4 of the revenues for the health insurance fund at 76.66%. Again, these figures are as of March 31st. Likewise, for the actives, for the expenses rather, health claims expense accounts for almost 90% of the expenses in the health insurance fund. Our next slide is similar. It is in regards to the OPEB fund, which shows that employer premiums as of March 31st, 2024, accounted for 77.07% of the total revenues for the OPEB trust fund. And as far as expenses, health claims expense accounted for 90.6% of the expenses in that fund. The next slide is just basically a detail of the revenues and expenses by account for the healthcare fund to show for example, in total revenue, when we said that there was a year-over-year increase of $2.2 million, the $2,221,832. This shows a breakdown by account of exactly what was it. Was it employer premiums versus employee premiums or your other income? The same is true for our expenses. As we go down, we see by categories of personnel, materials and supplies, or M&S, claims, and so forth.
Any variances that were different that are worth noting?
I would say that when we look at the employee contributed, the general total revenue towards the top, the last line in the total revenue section, you will see that there is a decrease year over year of almost $3 million. And I assume that is related to the change because we switched from select and choice. I believe we had a change in the.
I think the difference is what ended up happening was we all went to select, and in select, I think the city picked up more than the employee did,
and the employees paid less. So I think more employees opted or by default went into the select option, which was cheaper. So other than that, I think everything else, that was the only thing that kind of jumped out at me as far as to provide an explanation for. But.
Okay, thank you.
All right. The next page is also is similar format. It is for OPEB, and it just shows a breakdown by account, what factored into the overall increase in the revenues year over year for the OPEB trust fund of the $2.5 million. As you can see, employer premiums income accounted for most of that, of course, with $1.9 million increase year over year. Likewise, as we move down to total personnel services, total materials and supplies, and so forth, we can look by account and see what factored into the increases or decreases and contributed to the overall change in the OPEB fund for the 9 months ended March 31st.
And not really any major change in that expense.
Not in OPEB. I didn't see as much as we noticed in healthcare. And let's see, I think we're getting towards the end now. These the final two slides that we have here, again, starting with the health insurance fund. These are showing healthcare claims by the different categories and by month, with the total claims for the actives showing a net claims of $51.2 million, which ties back to our first slide that we looked at when we saw the gross and net health claims expense. And the similar reasoning for the OPEB fund, which is reflected on the last slide.
On this slide, the previous slide, can you explain how we have a negative Blue Cross Blue Shield prescription with choice? How does that work? we paid out negative. We got paid more money back to us because it looks like this is what we're paying out our claims, right?
I can research to
There's something
provide a
in
more.
January that comes in big time negative. Are those rebates that we're
I
getting
don't-
back?
I'm thinking they are in fact rebates. They're come back because we factored into the change into the still reflecting some change from the choice versus select, even though this is for this current fiscal year. But I can research trying to find a more
Look into that and maybe
definitive
give
answer.
committee members
Okay.
an explanation for that. Just send us an email and let us know.
Okay.
Do we have any questions for our comptroller, gentlemen?
No.
Okay. Thank you so much, and
All
thanks
right.
for being here.
All right. Thank you.
That wasn't horrible, was it?
No, I
Could have
guess
been a
not.
lot worse,
No.
right? Good. Okay.
Thank you.
You're very welcome. Next up on our agenda is our data dashboard here. And let's see who's going to present that. That's coming up with PwC.
Yes, sir, PwC.
Hi, Abby Cape Romero with PwC. We're the health and welfare consultants to the city of Memphis. So a little different than the financial dashboard we just saw. This is the quarterly update. So it looks at the plan year calendar year. So we're comparing quarter one of 2024 calendar year to quarter one 2023 calendar year. A few things to keep in mind as we look at this. This is the first quarter. Things are always look a little more volatile in the first quarter because it's just one quarter of data versus as we go along with the year, we're going to be adding more information. The other thing to keep in mind is that in Q1 2023, there was a choice plan in 2023 and there was a choice plan in 2023, but we've seen a big shift in enrollment to the select plan this year. So those are a few factors that are playing into the numbers. As you can see on this first page, this is total population. The number of covered employees is up as well as covered members. The total plan cost is up 5.6%. Used HRA contributions are up 82.9%. And that is because there aren't HRA contributions in the choice plan. So with higher enrollment in the select plan, there's higher contributions to the HRA. Employee premium share is down 18%, again, because of the shift from choice to select.
Can you point where those are on the dashboard sort of for us?
Yes, so in the folded version, this is the first page. It's quarterly update Q1 2024
like this?
dashboard. Yeah, so I think,
All right, thank you. Okay,
yeah, on the screen, if you could scroll, yeah, it's the upper right.
I
Yeah.
got it now, thank you.
Total net city cost is up 20.5%, and net city PEPM cost is 16.2. Part of that is it being one quarter of data. Part of that is the shift in enrollment to the select plan. Another factor is that in 2023, there was an extra rebate check in Q1 2023 for 1.9 million. So that's another big factor. And it's actually expected that throughout the course of 2024, rebates are going to improve because of the new negotiated contract. So moving down, the next section is just medical paid claims. This is, again, actives and retirees. Overall, medical claims are up just 1%, which is much better than what we're seeing in the market, around 7 to 7.5%, I think is the average. The pharmacy prescription drugs are down 0.7%, and that is in part because they were up 34.5% in Q1 2023. The 2-year trend on average is 15.5%, and that's in large part driven by the GLP-1s and the name brand weight loss drugs. The city saw a fairly significant uptick in utilization last year, but we haven't seen it continue to climb as rapidly.
Is that because we've made them not covered?
I think there was more so that there was a rush when they initially came on the market, and haven't seen as the trend hasn't been as strong.
Yeah, because I was under the impression we're not covering weight loss drugs. We're only covering the diabetic drugs at this point. We're actually covering the Zimpeps too.
I believe that is the case, but I would have to confirm.
Do you know about the formulary on that, Ms. Fouché, or does someone know for sure? Yes, ma'am. Come up and tell us about the formulary situation there.
Good afternoon. I'm Gertie Ryan with Blue Cross Blue Shield of Tennessee. When the weight loss drugs first hit the market, there was no formulary or any prior authorizations in place for those. Effective July 1st of last year, we did implement a prior authorization. So that's why you see the weight loss drug coverage decreasing.
Now, on the prior authorization, are there actual things that people can do to be authorized, or does it just mean that we're not giving it to people?
No, there are certain criteria that they have to meet in order to obtain those drugs.
And what are those criteria?
One of them is they have to be diabetic in order to have prior authorization for those drugs. Now, as far as
No, that's for the diabetic drugs.
the diabetic drugs,
What about
right.
the ones that are approved just for weight loss?
Now, your weight loss drugs, we do have a formulary with just the weight loss drugs, and I don't think there's a prior authorization for those particular ones.
So
But initially, those
you-
weight loss drugs and the diabetic drugs, regardless, were being covered, and now we have a prior authorization of those. And so there's a
I think
decrease there.
as we move forward, that's going to be interesting to see, because I think that what's happening is they did take the diabetic drugs, which were being used off-label for weight loss,
Right.
but they're the same drug. And then they've named the same drug Zimpep as opposed to Ozempic, right? It's the same drug, and they just put it through studies for weight loss. And I don't think we're covering that. And there may be a prior authorization, but it could be this is a non-covered drug. So I'd like for us to see what that is, because I don't know what the end stage numbers are going to be for this for our employees, but because if we get people's weight down, and then they don't have a heart attack and they don't have bypass surgery, how many people have to have bypass surgery for us to survive and actually make a net improvement? We don't know yet.
Yeah, and so the City of Memphis Pharmacy Benefit has always covered weight loss drugs, so we can see exactly which of those drugs are being covered and the utilization in that space.
Okay, at our next meeting, will you bring back to us a report that shows us specifically the diabetic drugs that are being used, that are these high-cost drugs, and the weight loss drugs that are being used, that are these high-cost meds, so we as a committee can see that?
Absolutely.
Okay, sorry for interrupting. Thank you so
No,
much.
that's okay.
Good.
Thank you.
Go right ahead.
Okay, so turning the page, that brings us, and on the screen you'll have to scroll down. On the left-hand side, we have the active population. So the numbers are similar to what we were seeing overall. The population is up. Total plan cost is up 8.3%. Again, the HRA contributions up significantly, with employee premium share down 22%. And the net city cost up 26%, and net city PM cost 22.8%. And again, there was the factors we mentioned before.
This is just sort of first quarter stuff, because it really should be down if we've got more people in Select, correct?
Correct, the total claims cost because of the better discounts.
Okay, thank you.
And again, the extra rebate payment made a big impact in Q1 of 2023. So moving down to the medical claims only, for actives, the medical trend is up slightly more than overall at 4.1%, but still significantly better than what we're seeing in the market. Prescription drug claims are down 3.4% in the active population. They were up 43.7% in Q1 of 2023, and on average have increased 17.9% on average over the 2-year period. But again, that's something that we expect to see smooth out as the year goes on. On the right-hand side, we have the retiree population. This population always sees a bit more volatility than the active population because they are much smaller than the active population. The employee population is up, the retiree population is up 11.4%, and total members up 14.4%. Total plan cost for the retirees is down 4.5%. Total HRA contributions up 153.2%. Again, that shift from the choice plan to the select plan. And employee premium share is down 5.9%. Net city cost is down 0.3%, and net city PEPM cost is down 10.5%. On the claims, specifically the medical claims for the retirees are down 13.3%. And that's in part due to the increased enrollment in the select plan. Again, this is one of the areas where we see larger volatility just because of the smaller size of the population.
That particular graph is interesting because if you look at that February-March spike, that was our last big COVID spike.
It was.
Keep going.
Yep. And the high cost claimant experience for the retirees is down as well. On the prescription drug side for the retirees, pharmacy claims are up 10.5%. In 2023, they were down 3.9% in Q1, so on average, an increase of 3% per year, which is well below market trends. Turning to the back page, we have a utilization overview. You can see that utilization is up of medical services across all categories. The most significant being inpatient, which saw an increase in maternity cases and deliveries, as well as emergency room is up 36.1%. When we looked at it, it was a little bit interesting. There wasn't an increase in avoidable ER. That remained relatively flat. There was a spike in influenza and hypertension. And then on the outpatient surgery side, the 18.4% increase in utilization is driven primarily by an increase in colonoscopy screenings, which is a good thing. And it seems to be a little bit of a rebound from avoidance of care during COVID. Along with these increases in utilization, you can see almost across the board decreases in cost per service, which is what we typically see with increases in utilization, with the exception of physician office visits, which increased $15 on average per visit. Moving down to the prescription drug utilization, total fills per 1,000 members is up 3.2%, offset by a negative 4.7% in the cost per script. Specialty drug fills per 1,000 is down 8%. And then a few good metrics, generic utilization rate and the percent of scripts filled via mail order are both up. And then the percent of cost for a mail order is up. It says 51.5%, but that's actually just a 0.5% increase. It's just a small number to begin with. And then finally at the bottom, we have the city's Blue Health Rewards program. Participation in the program is down 5% from the same period in 2023, but redemptions are up 4%. The most popular programs for redemption are behavioral health visits and annual WellCare visits.
I just would like to point out, if everyone looks at our cost category and looks at physician office visits, you'll note that those are the least expensive thing that we pay for, which is why you don't go into primary care to make a lot of money. Okay.
Exactly. And
right.
that's all.
Any questions on the dashboard? Okay. Excellent. Thank you very much. Okay. And next up on our agenda is healthcare program status. Ms. Hall Lewis, Chief HR. And now we're back in this,
Yes, sir.
okay.
Page 7. So this is just a recap in regard to the special enrollment we had relative to our voluntary benefits after the RFP. Oh, if I skipped.
So I have it on this one. Page 7. Thanks.
Look over there. Does everybody have it?
Okay. Make sure you got spelling right. Go right ahead.
Okay. And so this is, like I said, this is just a recap in regard to what occurred with our voluntary enrollment with our new provider after the RFP. So from the active side, you can see there wasn't a lot of movement from the employees in regard to AFLAC. Our new carrier is Trustmark, and so you can see that several employees took advantage of the Trustmark opportunity. We do not have the data in regard to how many transitioned over to self-direct pay, like just putting it on their credit card or going through their own personal bank account. But this is reflecting those who chose to participate, and it's coming out of their checks via payroll deduction. And then on the retiree side, the retirees were able to keep the payroll deductions moving forward. And so you can see there wasn't a lot of transition in regard to AFLAC and Colonial. The numbers are nominally close.
And these are programs that we have that people can choose to be in to cover their deductible, correct?
No, these are programs that, like cancer.
Okay.
If you get like a diagnosis, they'll pay you certain things.
So
I know
it's a cancer policy.
cancer policies, AFLAC, hospital indemnity. Like if you have an ER overnight stay in the hospital, they'll pay you a certain amount.
Okay.
There's also a gunshot insurance plan for firefighters and police officers.
But it's actually included, now it's included in everybody. Yeah, it's all city employees, and it's wrapped up into
So, and this
the
is
accident.
something people choose and pay extra for, or this comes with the regular benefits?
This is something that they choose to pay extra for.
Okay.
Yes, sir. Okay. So we will now transition into the healthcare update, and no, it has not. Oh, there it is. Okay. So these are our top 10 specialty drugs. In the past, I kind of like read them all out and said the numbers. I just kind of wanted to ask the body if you want me to continue doing that, or if you just want to take a look at it, and if you have any questions, we can field those questions at that time.
Yeah, I think that since this is a public meeting, just go ahead and you can like summarize it by saying out of the top 10, 4 appear to be diabetic and cardiac conditions. 3 appear to be inflammatory. 1 looks to be a skin condition, 1's HIV, and the other's a weight loss drug.
Yes, sir. And the top 10 comprise about 1,254 scripts out of 37,000 total prescriptions. And the cost for the top 10 is $2.2 million. Oop. There's a little delay. Okay, this next slide, we'll stop jumping, depicts specialty drugs as well. So there was,
It's from July till March.
yes, July through this last quarter in March 31st, 2024. There's
So,
Or-
so it's just a combination, so instead of having the last quarter, we have the last 3 quarters?
yes, sir.
Okay.
And so over the last 3 quarters, there's about 4 diabetic drugs, 1 weight loss drug. I do see Wegovy on there. HIV, skin conditions, and inflammatory conditions kind of round out your top 10. There was approximately 3,934 scripts out of a total of 119,000 scripts. And the cost for the last 3 quarters has been $7.2 million.
So that looks to me like it's almost 35–40% of our total drug costs are in the top 10. And so the 19 million is total drug cost for the 119,000 scripts, and in that top 10 group, it's taking up a significant portion of our drugs. Is that correct?
I would agree.
Okay. Which was what I was asking about, just the weight loss drugs and what that does in general.
Sure.
Okay.
So now we're going to transition to our wellness updates.
Any other questions on these drugs, guys? We're good? Please do.
All right, Melody Scott, Employee Engagement and Compliance Manager, to give the wellness updates. We'll start with updates on our new employee health centers. So we have 2 health centers, the Poplar location and the City Hall location. For the month of March, we saw total utilization of 393 for both locations, with Poplar having 257 visits and City Hall having a total of 136 visits. And I'll break it out over the next few slides. City Hall utilization was a total of 136 visits with 120 unique patients, including 6 of our retirees. And you'll see a breakdown of different categories from the employees to spouse to dependent utilization. The next slide shows utilization for retirees at City Hall. We had a total of 6 retirees to visit the City Hall Employee Health Center, 4 being retirees and 2 spouses. Top 10 diagnosis seen. You'll see that we still have our hypertension as one of our top 10 general symptoms that may be associated with other conditions: acute pharyngitis, COVID, long-term current use of antibiotics, acute maxillary sinusitis, other acute sinusitis, acute upper respiratory infection, seasonal allergies, and flu. Moving on to our Poplar Health Center. As you guys know, we opened the center on March 4th, so we only have 1 month of data, but I'm pleased to announce that we have seen 225 unique patients with a total of 257 visits, 50 of those being retirees. This slide shows, again, a breakdown from the employee, spouse, and dependent visits. Poplar retiree utilization, again, we had 50 visits, 43 of those being retirees, 6 retiree spouses, and 1 retiree dependent. Top diagnosis seen at the Poplar Health Center. We see a majority of the same diagnosis: acute pharyngitis, hypertension, COVID, seasonal allergies, common cold, and flu. and we heard you. So as requested, all retirees can now access the employee health centers. We've been busy since our last HOC. As you guys see here, this is a copy of the communication campaign that we sent to our retirees, letting them know the good news. There's a front and back side. All of our retirees have received those. They were mailed out on April the 26th. I have been notified that some retirees did not, so I'll get with Acre to see who those retirees are and make sure they get the message. We also have the palm cards and mailers printed, and we'll have them located at the fire and police associations along at Acre. Okay, next slide, please. Our diabetes management program managed by Livongo, we see that we have 322 members enrolled, with 85% being active. We've seen a 1.8 decrease in hemoglobin A1C for uncontrolled members. 71% of our members in the program for 6 months or more are controlled. In terms of engagement, we see 81% for both device monitoring and self-guided activity. And the majority of the coaching engagement is in the digital format. Pre-diabetes management. We have 517 members who are enrolled, with 90% of those members being active. 67% of our activated members have lost weight, and these numbers, I don't know if I mentioned, are for the month of March. We have approximately 80% of engagement in device monitoring and self-guided activity. And again, we see more engagement on the digital coaching side versus the on-demand and scheduled coaching. For our hypertension management program, we have 705 members enrolled, with 85% active. We have 81% of our members who have maintained or improved blood pressure control. 66% are engaged in device monitoring, 80% engaged in self-guided activity, and again, we see more engagement, in digital coaching with 26%. And I want to point out here that the health center will be another touch point for our employees to learn about our programs. I'm working with our marketing team to have some resources available for them in the exam rooms.
Any questions? I just want to say those are impressive numbers. It just would be nice if we had more people that get involved, but it seems like it's going up. It looks to me like the numbers seem to be improving every time we have a meeting. Is that just my impression, or is that reality?
I can go back and double check, but I believe so.
Yeah. So I mean, and that looks good. Any other questions? Yes, sir.
Who are the providers at the clinic?
So our health center is now managed by Care ATC. They did the sourcing, and so a lot of our providers did come from Baptist Hospital Medical Group.
But they're
Did
nurse
I answer?
practitioners.
They are nurse practitioners. I'm sorry. Yes.
It'd be interesting to see what it cost us per visit. So we have an idea of what our overhead is, just to make sure that we're breaking even, or so we'll know what we're paying, per person based on what the expense of each clinic would be. So just overhead on the clinic, and then divided by the number of visits and the number of people. That'll give you an idea if it's profitable. But again,
Yes.
This is one of those things where you're giving a service and you're getting people's health better, and then that person doesn't have bypass surgery. How much money do you save? And it's we don't really have a way to calculate that Actuarials, I think, probably do, but I don't think this committee does.
I think, if I may,
Very good, Mr. Tomei.
that contract price was a flat rate, wasn't it? With ATC, we were just paying them X number of dollars per year, and they.
So the contract is we have a service rate, but it's mainly pass-through costs of salaries and supplies. The administrative fee is based upon those expenses. It's a percentage of those expenses.
Okay.
But you have a salary that you pay,
Yes.
okay? So if you're paying a salary and the person sees one person a week, then it's a pretty high deal as opposed to seeing 50 people a week. So
Exactly.
it's sort of like, that's where the volume comes in to let you know your value, because the more people they can get in at a fixed salary, the more efficient it is for us as a city. All right, thank you very much. That's a great report. Any other questions? Okay.
I have a couple more slides and
Go
then
right
I'll
ahead.
be finished. We are launching a campaign to promote our teledoc services. So those are our telehealth options that include dermatology, nutrition, physical nutrition through teledoc. And they'll be sending out mailers to all of our members to let them know that although we're on vacation, you can still receive care, just to make it convenient. So those will go out next week, starting May 23rd.
On the teledoc, that's through the app, right? The Blue Cross Blue Shield app?
There's a
Tele-
separate
or separate
teledoc.
app.
There's a separate app, but you can get to it from the Blue Cross Blue Shield site.
Is there a way
Yes.
for us to start getting some statistics of how often this is used?
I can ask for that, yes. Okay. And last but not least, wanted to make sure everyone is aware, we are actively hosting biometric screening events on site. So right now, we're focused on the fire division. Next month, we'll focus on the police precincts. However, all employees are welcome to come to City Hall on July 15th from 11 a.m. to 4 p.m. And then at Glenview Community Center, July 16th through the 18th from 11 a.m. to 4 p.m. and July 19th from 10 a.m. to 3. And as you guys know, members can earn a $50 wellness incentive for completing a biometric screening.
Excellent. And I guess we have open questions. If there are any other questions, go right ahead, Mr. Turner.
I'm not sure who needs to take it. I think we've done a very good step so far in allowing all the retirees to go to the employee health clinic. What else can we do collectively to help the retirees? Because it's apparent that the city has no desire in giving the retirees a cost of living increase. So what can we do to help them financially, whether it's, and as much as I hate this term, premium holidays, or giving the post-65 retirees a little bit more in their health reimbursement accounts every year? What can we do to help offset some of their expenses? And I'm hoping at the next meeting we can get some kind of report back on that, because it's been 12 years now since the retirees have had a cost of living increase. Insurance is going up, co-pays are going up, they're getting sicker as they get older, so they're having to spend more money out of pocket. The pre-65s, not as much, because they're getting, if they're not on the city plan, they get their HRA $5,000 or $10,000. But if they're post-65, they only get $1,000 or $1,500 if they're married, which if they're having to pay for a supplement plan, that $1,500 doesn't last very long. So we collectively, everybody in this room, need to make a concerted effort to see what we can do to help the retirees, because they're not being helped. We can say what we want, they're not being helped. So I'll do my part and do what I can to help, but I'm hoping at the next meeting we can have some kind of comprehensive report or plan to help the retirees.
Excellent point. And hopefully as we go through budget, that will come up and something will happen this year. But we'll see.
Well, I would like to see that too, but.
Yeah, so would I. Any other questions or comments?
Yeah.
I've just got one very quick, and I should be more up on this. I've been so busy lately. The spousal surcharge, are we still doing is the reimbursement?
Yes,
Okay, so at some
at the end
point
of the year.
in
Yes.
the December, okay.
We're
We just
planning
need
for
to,
it.
we need to remind somebody.
It's on the
November.
calendar. It's on the, trust me,
Yeah, I've
it's
got it
on the
on my-
calendar. It's on everybody's calendar.
Thank you.
All right, well, that being the case, thank you very much, ladies and gentlemen, for being here. We are now adjourned.